Gentamicin, trade name Cidomycin, is a medication used to treat gram-negative infections when penicillin is not effective. So what it does is that it inhibits bacterial protein synthesis. And by inhibiting this protein synthesis, it actually will stop the bacteria from being able to grow. Okay, so in other words, it's bacteriostatic. Okay, it stops it from growing, stops it from spreading, whereas other antibiotics will actually kill the bacteria. This one really just stops it from being able to synthesize new proteins and being able to carry out growth. So its therapeutic class is anti-infective. Pharmacologic class is aminoglycoside. When you hear that suffix mycin, you should be thinking of these aminoglycosides. Gentamicin, okay? So anti-infective aminoglycoside. The reason it's used, okay, like we said, is really for gram-negative infections, and it's really going to be used when penicillin isn't effective. So if it's not really working, the penicillin's not working, we would up our game with throwing gentamicin at it. Some of the nursing considerations for it, and this is the biggest one that I want you to remember, this is what you're going to be tested on. So remember that this can cause tinnitus and hearing loss, and we never want to administer it with penicillin. Okay, so the biggest thing that you would think about with your patients on this, and the test question you're going to get, is you have a patient receiving gentamicin, they have tingling in the ears, what do? You would know this is a side effect of gentamicin, and we would really want to address this quickly because it can lead to this tinnitus and hearing loss, okay? And again, we never give it with penicillin. We want to use caution in renal impairment, and we always want to assess our infection, okay? Biggest thing, I know I talk about this all the time, but one of the biggest things with any antibiotic is that we want to assess the infection and run blood cultures prior to starting antibiotics. We want to know what type of infection they have, what type of bacteria it is, where it is, what's going on before we start the antibiotic, because we want to be able to determine if we're giving the right antibiotic, number one, and we want to determine is what we're giving working. Okay, so if we give our antibiotic first and it does work on it and then we run our blood cultures, we're not going to really get a real sense of what's going on here. You also want to monitor your liver function test and monitor blood levels of the drug. So gentamicin is one of those medications that we're going to monitor levels with, and we're going to see are we in a therapeutic blood level range of this medication. But the biggest thing I want you to keep in mind with this is that it can cause the tinnitus. That's what you're going to be tested on. That's what I want you to remember. That's what I want you to think about when you're working with your patients who are taking gentamicin. Assess their hearing. If they notice any tingling in their ears, and you should ask them, but even if they just mention, I'm having a little bit of tingling in my ears, what's going on? You should address that this is something that needs to be looked at closer for patients taking gentamicin. All right, so that's gentamicin, trade name Cidomycin. This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.